There's going to be 5-minute pitches back to back. Questions can be asked at their demo tables in the co-working section. And then we'll hear from Brad Bennett, our partner at North Shore Edward Elmhurst Health, and we'll hear from one of the managing partners of the fund. My ask of you, the audience, is to connect with these teams, check out their demos, and accelerate their growth. I'm going to have Miriam Salah come to the stage to introduce the first team.
Everyone, so I stand between you and the first pitch. So my name is Miriam Saleh, and I'm the Executive Director of the Kaplan Institute for Tech Entrepreneurship and Innovation at Illinois Tech. And I'm here to introduce AuraSense. So maybe 15 years ago, I was a grad student. And as a grad student, I studied how the brain controls precise hand movements. And the idea behind that research was to essentially use that information to bypass the spinal cord injury and reinnervate the nerves in the arm and hand so paralyzed people could move their arm and hand again. So you could imagine that with this kind of a background, I was so excited to meet the team at AuraSense because they weren't making brain implants, but they were really interested. You know, Amber Ivy, who's the CEO of AuraSense, had a personal experience where she found a need connected to some of the work that I used to do, but they took it to a next level, right? So AuraSense is here because they're really passionate about the idea of detecting precise hand movements and using that to improve hand assessments. Hand assessments is an exam that's done in patients who have neurological impairments. And today, there's no quantitative assessment. And that's a problem. And you don't need to take my word for it. I was a scientist, so I'm not the right person to talk to. You have to talk to people who have lived experiences, who are patients and are really understand the pain points around not having a quantitative tool to assess hand impairments. And so with that said, I will introduce Amber Ivy to come here and share her experience and her business.
AuraSense, Aura.
Last week, can you hear me? No.
Great job, Miriam.
I think you hear me now. Okay, great. I tend to be loud, so we're going to get started. Last week, I had a brain exam. I'm pretty sure in your mind, you're thinking about me going through an MRI or having things connected to my body. That's not what happened. What happened was my new neurologist basically told me to walk down a hall, go back and forth, to touch my nose, and to do these different activities that she wanted to see how my body was responding. This is because over 50% of exams for neuro and brain disorders are done literally by observation alone. This is not something you can repeat. This is something where in a month when I go back for my checkup, she's not going to remember those 3 pages of notes she wrote down about what was happening with my body. I live with multiple sclerosis, and I've been living with this disease for 12 years. I've actually been misdiagnosed twice, and even last week with a new neurologist, they still question, is it MS or is it some other disease? And I'm not alone in this. A lot of people deal with this. One of the reasons why this is so important to me is because I'm a data professional. And when I go into the neurologist and I see her collecting all this data and writing it down, I'm like, is there a better way to do this? Where is the objective data? Where are the measurements that let me know and others know how we're doing and how that's working? And the reality is, brain disorders do not have that. And one area in particular that deals with this on an even more so basis is clinical trials. So clinical trials for clinical trials for brain drugs have to go through the same process. They have to have a neurologist who's checking on the patient to see if the patient has improved. Imagine now in the current state where I just told you, effectively you watching me is a neurology exam. So they're doing this, and then these drugs that are actually safe are not proven effective. That is a concern. And because of that, AuraSense has created a solution. We take those objective exams that you see on the left side of my screen, and we put them into one comprehensive automated exam that captures the things that Miriam was just talking about. How I move, how I talk, my hand movements. We also capture biometrics that allow us to understand your heart rate and put those things all together in one versus what happens now, which is 5 different exams, 5 hours, 5 clinicians. We do it in one exam in less than an hour with one clinician. allowing us to get true data that is repeatable and that can happen again. Our technology is pretty cool, as I say so myself. We use mid-air haptics, so make sure you come to our demo to feel sound and you'll understand what that means. But we're gamifying the experience. So people like me can go in and do my exam and get data capture on my hand and give the neurologist a report that tells them exactly what's happening and baselines against myself so that I have the tools that I need. Who are our target customers? Because we want to start with clinical trials first, we're looking at places like Pfizer. If you know anyone, or if you're here from Pfizer, talk to us. But we want to make sure people who have diseases, sorry, just being honest, people have diseases like Alzheimer's, Parkinson's, multiple sclerosis. A lot of you in this room know people, particularly with some of these diseases, who are living with this, and it's only going to continue to grow. So we want to make sure they get the drugs they need, because 1,000+ clinical trials are going to happen over the next 3 years. We want to make sure they have safe and effective drugs. Who are our competitors? There are people out here who are measuring different aspects of it. The thing that makes us different, we do it all in one place. We allow you to have it at one time, and you don't send a patient around trying to collect different data, wondering if someone didn't wake up today on the right side of the bed, is rushing to an exam. We make sure that this is all very objective. Our business is a hardware as a service, so we offer subscription for our tools. We put our kiosks in the hands of those clinical trial folks, and then we get paid basically on a monthly basis. We believe this can create $30 million in revenue over the course of the next 3 years with 300+ clinical trials. But I do want to say we don't want to stop there, because we do believe this can be used to train neurologists on how to care for patients, as well as putting this in the home of folks who are living with these disorders, so they do not have to leave the home and they can get the care they need through remote patient monitoring. The market is huge. We're starting first with the clinical trial, which is a $2 billion market, but we want to make sure that we continue to grow and do this work. I believe that our team is the right team to do this, because not only do we have the lived experience, we also have the passion and the skill sets. We've brought together scientists as well as people who are living with these diseases, who are really ready to tackle this problem and hopefully solve a solution. I'm excited because we've only incorporated last November. We've already filed 3 provisional patents. We've finished our prototype due to MHub and the work that has been done here, so thank you so much, MHub. And we've had over 350 stakeholder interviews that got us to define and refine this product. We're on our way to raise $1.5 million in the last 2 weeks. We actually raised $350 of that $725K that you've seen. Feel free to, I saw a little clap, feel free to clap. Sorry, very exciting. I'm a first-time founder, so like, this is great for me, so I'm excited about that. But I want you all to be a part of that. And the reality is, observation alone is not okay, even here today as you all are watching me. I want you all to join in and be a part of the action. So please meet me at my demo table so we can all change the standard of how neurology care is done today. Thank you all.
Amber.
Okay, thank you. I'd like to
That was it.
Jack Hutchins.